Thank you. Next on the podium, FP17, Dr. Teresa. Ocular manifestations in patients with psoriasis attending a tertiary healthcare center.
Good morning. My presentation is on ocular manifestations in patients with psoriasis attending a tertiary healthcare center. Introducing psoriasis is a systemic condition affecting 1 to 3% of the world's population. It's a chronic inflammatory disease affecting the skin. The pathogenesis is immunocellular dysfunction and inflammation. It manifests as erythematous and squamous plaques. Ocular manifestations in psoriasis can be due to direct or indirect mechanisms. Direct mechanisms include eye involvement with psoriatic plaques, and indirect mechanisms include immune-mediated inflammatory response. Aim and objective: early detection of ocular manifestations observed in patients with newly diagnosed psoriasis, and to detect and report any changes in retina using OCT. Materials and methods. Study design: it was a cross-sectional study. Study setting: in the Department of Ophthalmology and Dermatology in a tertiary healthcare center. Sample size: it was 50 patients with newly diagnosed psoriasis. Those patients who had signed the informed consent and those obtaining high quality OCT images, that is signal strength 6 out of 10, were included in the study. And those patients who had history of ocular trauma, ocular surgery, or with Stevens-Johnson syndrome were excluded from the study. Method of data collection: 50 patients with newly diagnosed psoriasis were selected. Detailed history and examination were done, and OCT, macula, and RNFL were recorded. Coming to results, out of the study sample, 54% were males and 46% females. 32% of the people had visual impairment, and 68% were vision was normal. The ocular manifestations found were dry eye, keratoconjunctivitis, blepharitis, uveitis, episcleritis, and cataract. The corresponding percentage of these manifestations were dry eye 40%, keratoconjunctivitis 30%, blepharitis 14%, uveitis 12%, episcleritis 8%, and cataract 20%. The mean IOP among the study sample was 14.26 mm mercury. Mean photostress recovery time was 19.15 seconds. Mean RNFL thickness was 92.54 microns, and mean central macular thickness was 258.90 microns, which were all within normal limits. Coming to discussion. Psoriasis, being an immune-mediated disorder, affects the lacrimal and meibomian glands, thus causing dry eye, which is the most common ocular finding. In psoriasis, normal eyelid flora is disrupted, leading to overgrowth of staphylococcal species, thus causing blepharitis. In psoriasis, pro-inflammatory cytokines are increased, like TNF-alpha and IL-6, which increases oxidative stress, leading to secondary cataract formation. Coming to some similar previous studies, Kalia et al. In the study, Ocular Manifestations in Moderate to Severe Psoriasis in India, a prospective observational study conducted in 2022, concluded that most common ocular pathologies observed in the study were anterior blepharitis and moderate dry eye. Cosby et al. In the study Psoriasis and Uveitis, conducted in 2022, concluded that relation between non-arthritic psoriasis and uveitis have not been fully elucidated. Physicians who treat this disease must be cautious and refer their patients to the ophthalmologist even if they do not have any symptoms. Concluding the study, psoriasis has several ocular manifestations even at the start of the disease, many of which leads to visual impairment as well, such as uveitis, keratitis, and cataract. Most of these are curable, and further complications like corneal ulcerations due to severe dry eye can be prevented by early detection. Hence, patients with psoriasis should undergo regular eye examination regardless of risk factors to monitor for progression of ocular manifestations. These are my references. Thank you.
Okay, thank you.